Peri-implantitis definition, diagnosis, and treatment. Yeah? We already know the definition, and we know the clinical signs and symptoms. This is the investigation, and this is the treatment. And look at this. You know, this is really nice. Empirical antimicrobial chemotherapy, appropriate antimicrobial chemotherapy, subgingival curettage, flap surgery, and the only thing that is missing here is what? Extraction. Extraction of the implant. All right? Next. And these are some filling implants, and you can see that, some of them is due to as a result of overloading of the implant. You know, I think this is too wide apart, all right? And then when implants are too close apart, there's a problem. Next. And one of the technique I want to teach you around filling implant is that, you know, you can actually use the implant to stabilize the membrane, put bone graft under it, and then tuck it around, and it works really well. All right? The patient legal aspect of dental implants, and this is a very sensitive issue. Next. Now, medical legal issues that relate to dental implants, which clinician must be familiar with, are very important. And medical legal issues that impact on risk management by medical indemnity organization and the indemnity premium they set for their members has also made medical legal issue of importance. Current medical legal environment, and this is exemplified by current situation in Australia. The most significant area of changes has included progressive introduction of advertising within the healthcare system and profession changes to existing tout laws and the addition of new legislation. Now, negligence is an issue. Intentional interference is also an issue. And then you must be able to distinguish between absolute liability and strict liability. Let us look at advertising. Deregulation of the legal profession and almost the universal use of aggressive advertising by legal firms has fueled an increasing rising trend in claims and award in North-South Wales in Australia. And litigation in North-South Wales is fast approaching that in California because lawyers are now assisting vexatious litigants. In practice, this filter depends a great deal on the skill and experience of the lawyer, and the inexperienced solicitor may support a weak case beyond its value with consequent unnecessary anxiety for the clinician. And basically, what that means is that, yes, your patient goes to the lawyer, and of course, the lawyer needs consultation money, the lawyer needs money to take this case forward, and so on and so forth. They don't tell you what you, the patient, has to lose. They just tell you, yes, we can pursue it, and so on and so forth. Of course, the dentist also suffers because he also has to go and get a lawyer and has to go to court and this and that. So, you know, it is not easy. Dentists are now allowed to advertise claims, and that is true. Claims in this advertisement are obviously designed to attract patients, but should be governed by State Dental Act and Trade Practice Act to avoid misleading the patient. Again, this is an issue that we need to address in every country. Manufacturers, implant manufacturers, aggressive marketing by the clinicians in print media, in trade shows, and this has gained so much popularity, and this is confusing a lot of dentists. Manufacturers are advertising implant products that do not have scientific validation. And I was very surprised to visit a country in East Africa recently, and I heard that about 60 dentists or so were sitting listening to a company from Germany, K whatever S or what have you. I've never heard that name in my life. And whatever implant they are marketing, I'm not looking down on the implant that they are marketing, but I know that there isn't much clinical or scientific validation. And the osteoblastic index is the only way that an implant company can say my implant is better than the other implant. And of course, this is one of the work I want to start doing in the next 2-3 years, assisting companies to validate their implants in terms of osteoblastic activity, because that is the basis also of my PhD work. Because it is the amount of osteoblast that is surrounding the implant at X time and Y time compared to that of another implant system that will tell you which one is better and which one. Tort law in Australia has changed in 2 major ways. The definition of informed consent should also be taken into consideration. And Emerson was talking to us about this, was it yesterday or today? And then test of negligence is also very important. Dentists are now must now consider the Therapeutic Good Act, the Trade Practice Act as having a potential impact on their practicing responsibilities. Now, each forum, that's complaint forum. There are different complaint forums, and such as dental board or councils, the healthcare complaint tribunal, the consumer complaint tribunal, the anti-discrimination tribunal, and the court. And each of them have their own way of dealing with issues. Dentists may well find themselves before a tribunal that does not allow legal representation, so that the dentist has to present a defense without assistance at the hearing. Now, a civil claim brought to a district court remains the most challenging forum in Australia and most countries. And I think this is the way that most of the dental councils should go. When a patient comes to you, once the dentist has not done anything gross like sexual harassment and this and that, and right? You as a body, you may not even have somebody amongst you who has even seen an implant before. So how can you judge Dr. Y? So maybe if you feel strongly for the patient, you can say, well, the guy has done his work. We don't understand. Maybe what we can do is get expert representation from so-so place but it's going to be expensive, it's going to be costly. Okay, let us call in the dentist and see whether we can resolve this issue between the two of you. But most dental councils don't do that. You know, they go very confrontational. And a lot of people don't like you to confront them, huh? Especially if they feel that they know what they are doing. And the very moment you start writing somebody letters, strong letters, that do this, the person will also respond to you exactly the same way. And that is what is going to lead to extensive medical legal actions. Now, implant-related medical legal issues need to be discussed. And you need to appreciate the trends in litigation. And what I wanted to say before was that, you know, and when you as a dental counsel cannot assist the patient, you are not lawyers, you are not the law. You can say to the patient, if it is money you want back, go to court. If the judge feels that you are right, they will ask the dentist to give you back your money. You understand what I'm saying to you? And the court has a better way of getting expert witness, because that is their job. They will get expert witness. And if they say yes, you're going to get your money back, you will not even just get that money back, you will get the money that you have spent on legal action back. So why should a dental counsel be so edgy all the time to resolve this complaint that involves money? You know, it doesn't make any sense. And one of the issues is that the patients have very high expectation. Very high expectation. And, you know, I have done implant for a patient before. She came all the way from Kingston. All the way from Kingston. And when my patients come from abroad, I put them in a hotel. And I pay for the hotel. Okay? Now, after the surgery, you know, if it's a female, I'll take the patient out to eat with one of my assistants. You understand what I'm saying to you? And, you know, this particular patient, I knew she was trying to get very friendly. Long before she came to Montego Bay for her treatment. Long before. But I was always very official. Very, very official. I mean, I'll call her by her name and this and that. And we did the implant procedure. It was kind of very traumatic. She had post-operative swelling and discomfort. I dropped her at the hotel, and the hotel wasn't serving any food that evening. And I said to her, so I will pick you up and we will go and eat. We'll go and eat. And as I went to the hotel to pick her up, right in Montego Bay here, she wanted me to come into her room. So, I mean, I parked my car. I got her one of the best rooms, right? I can take you to the hotel. And I know how the room looks and everything, right? And basically, I horned, she wouldn't come out. And then she came out, she peeped out, she beckoned to me, I stayed in the car. And then later when she realized I was not going to come out, she came out and told me that she cannot find her keys. Kind of suggesting that I come and look for her keys for her. But I couldn't do that. I can't go into her room. Right? Now, so I said to her, just lock the door. And we'll just tell the people that you need a duplicate key. Of course, she was not happy. And to make it worse for her, I just called my wife. We used to live here then. I said to my wife, just make nice soup and so on and so forth. I'm going to bring the patient here. And she's going to eat soup and so on, She was very, very upset for me bringing her to my house. Yeah. Very, very upset. And even after that, when she comes to my office in Kingston, she wanted special attention and this and that. As I just flying from Trinidad through Biwi, she's on the phone. No problem, nothing. So, she has very high expectations of me that I could probably do some things for her which I probably can't do. She got upset at a stage, and for nothing, while we were doing her restoration, almost completing her restoration, she went to another dentist, and problems started from there. And I know why. But you see, the council didn't know why. But if they had called me, I would have given them the entire background and so on and so forth. And only for her to confess to me after 3 or 4 years. Because, you see, she took me to court. The council told her, take him to court in Trinidad. Right? Take him to court in Trinidad. Huh? She took me to court in Trinidad. She lost. They told her to pay me cost. And then they told her, don't worry, it's a mistake, it's a technical thing. Appeal. So she take me on again in Trinidad and appeal. She lost. Plenty money, for her to pay. And they told her on the 2 issues, pay Ogunsalu cost. Emerson, tell her, pay Ogun. It's in the internet, huh?
It's on the internet, I saw it.
It's on the internet. So I'm not telling you what is on, it's on the internet. Right? Pay Ogunsalu cost. And I'm going to take her house, eh? I'm going to take her house very soon. I will. It's just a matter of time. Because it's a lot of money I paid for lawyers. So you see the problem it creates, huh? It's a lot of money I paid on lawyers. And interest is coming on the cost. And she's running around. Just last year, she sent somebody to me, with some letters or something like that. And I just, did not, I know it's some beg thing. Because 2 years ago, she spoke to me on the phone, saying to me, Dr. Unsalu, I didn't know that they hated you that much. You see how life is, huh? She told me that. I didn't know they hated you that much. That if I had known, I wouldn't have gone that way. She told me that they pushed her because she was now getting scared. And it is only God and, a change of heart that will melt my annoyance of the whole thing. Because, sometimes it's just in my hand. The laws have said, pay him cost. Pay him cost. So that, you have to leave trouble. And the reason why I'm saying this to all of you, you may find yourself on the Dental Council in New Jersey. You may find yourself in the Dental Council here. You may find yourself in Dental Council in Boston. So that you have to give a chance for each party. For each party, to each party. Give everybody a chance. So basically, you have to know how to behave. Your enemy doesn't have to suffer in your hands. Your enemy can suffer in the hands of the others. published guidelines, evidence-based dentistry, clinicians training, and this is why you need to be trained. Because it's plenty certificates you are going to get from coming here. You're going to get ICOI membership certificate, and when you need expert witness to come and defend you against their own expert witness, you call ICOI, they will send one to defend you, or to represent you at no cost. You will get certification as Implant Prosthetic Society. You will get certification from attending this course. Your certificate just came by express this morning, signed by Kenneth, Judy, and myself. And then you will get certification from Cybron that you are certified to use Endopore, Integra, Pit Easy. Because when I become a lawyer, which I'm going to become, I'm going to become one, just a matter of a few years from now, and I come to court, and I say, is this clinician certified by the implant company to use that system? Where's the certification? No certification. Case is closed, Case is closed. There's no judge that can go further. The case is closed. And then the manufacturer's involvement. You need to look at that. All what the manufacturer wants to do is sell implants, sell implants. They're not concerned about you. And, Dr. Judith Mama, trust me, I support my delegates. You have any problem, you call me, I describe it to you on the phone, you can't solve it, I go on the plane and I come to you. And you see, I have a delegate in Kenya that has some very little problem she has. You know that, And I've told Amin what to do for me when she gets back to Kenya. So I support my delegates. A manufacturer don't care about you. When you have problems, I could call Cybron and say, Dr. Mark Zahn has some problem send me ticket, I'm going to sort him out. What else do you want? You understand what I'm saying to you? But purely a manufacturer and a salesman cannot do that for you. They sell it and they're gone. And then medical indemnity organization, and then you should consider risk management strategies. And let us look at the trends in litigation. And you have to listen very carefully to these trends. Bigger implant cases tend to be notified later than simpler ones. You notice that? The single implant cases are the problems. The multiple implant cases are not so much of a problem. And if there are problems, it comes much later. The period of osseointegration is an inbuilt reason why cases are likely to be reported in 1 year unless something has gone very obviously wrong at the stage 1 surgery. Which means that the surgical aspect is of importance, and osseointegration is of importance to both the patient and to the legal organization. The increasing reporting delay traditionally encountered in Australia means that implant cases may well not be reported until 4 years or more after the incident. Implant cases tend to have a significantly higher quantum than the average case. Again, patient's expectation. High patient expectation prompted by both dentist and manufacturer. Implant treatment is complicated and is of high cost, and because of this, it also influences the expectation of the patient. It is sold by dentists and manufacturers as the best option or alternative, and the professional material often available in the waiting room are always positive. You show them positive. You notice I don't have any professional material here in my waiting room. I have my concise version. I'll show you. It has a lot of things. It shows you side effects, the problem, and so on and so forth. That is good. I don't want to show you the smile of Whitney Houston and say to you that that is how you are going to look. I can't make you look like Whitney Houston. It's not possible. You understand what I'm saying to you? Next. And look at that. You know, people put all kind of things in their office. You can talk, laugh, smile without worrying. Your new teeth are firmly anchored and feel just like your own teeth. You can eat what you like without any problem. Maybe what you are trying to tell them is they can even eat stone and they'll be okay. You understand me? It is a safe, reliable treatment method. You recover your natural smile. You promise them a lot of things, huh? And you can imagine you promising a patient this. And then the patient ends up like this. You understand me? And this is going to be a real problem. You know, in 2001, I did implant for a patient. I was not very happy with the way the patient treated me, in that we wanted to complete it lower. So we did it from canine to canine. She promised that after that she will now do. And I said to her, because you're going to be overusing this, I'm not going to be able to give you warranty. Right? You need the back. But she gave me a problem. When I was delivering the lower 6-unit bridge, lovely implant, lovely restoration. But what the technician did was, it's lower, huh? They showed that will show in the mouth. Some technicians do it, huh? You know that. And I guess for self-cleansing or something, when she smiles, nice. And she kept on coming to me and saying, but Dr. Gonzalo. And she was so aggressive about it that this thing is showing there. I said to her, that is how it is. That is the best we can do for you. She went to a colleague of mine, and that colleague bad talk the thing. And that colleague also told me that, body, you could have done better and this and that. I just leave it. Huh? But of course, the patient grew to like her restoration eventually. And today, of course, she was upset with me, and she migrated to Trinidad, and I also went to Trinidad. And for years, she knew I was in Trinidad. She never communicated with me. And then one morning, I saw her husband and herself in the airport. And they spoke to me very briefly. And then something happened to her implant maybe 2.5 years ago. The abutment became loose. And she found out where I was living on a Sunday. And she came, and right in my sitting room, got the hex driver and this and that, and just put it back there with a smile. You know what I'm saying to you? It's a small world, huh? And of course, my patients are welcome to me anyhow, anywhere, as long as it's professional matter. Next. Now, new and current legislation. The Therapeutic Goods Act covers all medical devices such as implants and require that those devices be registered under this act. And Dr. Amin, you will realize that patients continue to get implants in different countries which are not registered in that country to be used. And this is a problem. Next. It is illegal under the Act for any individual clinician to purchase and import any unregistered implant system from overseas or to import components other than those registered. This act operates to sanction misleading, that is the Trade Practice Act, okay, to sanction misleading advertising and cover the issue of product liability. Next. Now, let us look at some claims that dentists can make. A dentist can say to you, to a patient, I am a general practitioner specializing in implants. May be right, huh? Because it is your peers that may come and make you a specialist, you know. When you are doing something and doing something and doing something and you're doing it very good, your peers will come and say, yes, that is the guy. If you want to do endo, that is the guy to go to. Just like Nolopati. You know? This is where Nolopati started endo career, my office, huh? Here in Montego Bay and Discovery Bay. He loved it. He never had any postgraduate training in implants. And from that time, top dentists in Kingston, I wouldn't mention name, were calling him to their office and he was doing root canals for their patients. He just loved it. Had a passion for it. I am a specialist. You know, for a general practitioner, that is probably too heavy. Okay? However, again, your peers can make you a specialist, especially by recommendation. You understand what I'm saying to you? In other words, you know, you want to be considered as a specialist in so-so area, and your council has such recognition to recognize, provision to recognize specialists, and if some organization or some international peer support you and say, yes, he's a specialist, and they document it, of course, you can call yourself a specialist. But you can't call yourself a specialist when there is no documentation. And let me tell you, Emerson is here. There used to be some rumors and so on and so forth that Ogunsalu is not an oral surgeon and he has fake qualification and this and that and that and that. Now, I became medically qualified. Trinidad is the only medical board in the Caribbean that has a specialist license register. You know that, huh, Emerson? They have a specialist register where they register oral and maxillofacial surgeon, the only specialist in dentistry that they register is oral and maxillofacial surgeon. Register people, urologists, general surgeon, and so on and so forth. And today, I am on the specialist registration. So that I just look at people and I look at them, and these people are stupid, eh? Because, look at the oral surgeons in Jamaica. They're registered with medical dental board. It's a general board. And I think one with myself were registered with the medical board. But the medical board here does not do specialist register. Right? So that in the Caribbean today, even those in Trinidad, we are two double qualified. The other one, she's a new young lady, right? And when I was the director of the dental hospital in Trinidad, I was already on the specialist license, and I looked at her things, and I personally vetted that, she should be included in the specialist. And they say, no, we want her to work for so amount of years, and then she can go on this. I think she's on it now. Right? So that it could be a long journey. Huh? And then this is very modest. I have done several implant cases successfully. Your patients will like that. Huh? Because all the other two is not telling them what they want. Huh? A specialist might have not done anything successfully. So that being a specialist don't mean nothing. And although I'm saying, yes, I'm a specialist, I'm registered as such, but it may not mean anything. Prior substantiation is particularly important when making claims about future matters, including likely success of treatment. Such future claims are taken to be misleading unless the person making them has a responsible basis for doing so. Don't advertise advantages of your services or products that are based on guesses or your own opinion. Make sure it is scientifically proven. Do not predict that what you cannot back up. And rely on facts and figure, not guesses and unsupported opinions. Next. On the manufacturer's front, there is a whole area of product liability. The manufacturer can limit the product liability by providing very specific instructions on the use of the product. If the clinician operates outside these parameters, product failure becomes the clinician's responsibility, even more so. Because you see, Endopore implant, when you read it, it says you cannot use this in patients with systemic problems such as liver diseases. And one day, I placed implants in a patient's jaw who had liver cancer. She knew she had it, but she wanted implants, so she never told me. And the person who referred her also hid that information from me. It's not on this island. Huh? There's a need for providing treatment reports to insurance and companies and courts. Now, with regards to tort law changes, you need to look at informed consent and the test of negligence. The courts have departed from the Bolam's principle that still pertains in the UK only. This principle held that medical peers determine the standard of care required by law. The law imposes the duty of care, but the standard of care is a matter of medical judgment. Applying criteria recommended by medical profession informed consent. What are the risks of the material? I mean, for example, the patient who you are going to be using BioGuide for may have a risk of mad cow disease, although there has not been any reported case. Careful discussion with the patient of treatment benefit, treatment alternative, and failure. Percentage likelihood of failure, and what happens when failure occurs. So when you sit down, and let me tell you, from another 3 months from now, every patient, I'm changing my case note, every patient will have a little cassette in their case note. When I'm talking, put it there. Everything is recorded, you put it back there. You come, we're talking, put it back there. Our talk. And our talk is more important than what we have written that you have not signed to all. You understand what I'm saying to you? So that is the level that I am taking my practice to. So that, there will be no issue of, you said this, you didn't say this, and, you didn't tell me what will happen when it fails. You didn't tell me that when it fails, you will suggest that I will come back to you and redo the treatment. And, you didn't tell me about the money issue when it fails. But this is very important. You need to tell your patient about the complications. And you need to tell them about the lifespan. And let me tell you the best way to tell them about the lifespan. And you need to listen to this very carefully. I say to them, yes, this implant is meant to last a lifetime. And it can last a lifetime. I don't know when you are going to die. If I place this implant for you now, and you die 2 years ago, 2 years from now, of heart attack, the implant has lasted a lifetime. And additionally, I tell them that remember, the teeth that God gave you, He intended for it to last you for a lifetime. But it never lasted you for a lifetime. And I will say, if you don't keep this implant the way you did not keep your natural teeth and you lost them, you are going to lose the implant. They understand. Publications that set out parameters which learned bodies believe are important in implant treatment. Courts rely so much on these guidelines. They are critical where there has been a departure. Then finally, we're going to talk about evidence-based dentistry, which is defined as a consistent and judicious use of best evidence available when making decisions with patients. Canavina et al. Have stated that health professionals need to be seen to carry out best practice procedure based on evidence-based treatment or practice to regain public trust. Various implant training pathways are available, but in general, those that are university-based offer long courses with a limited number of candidates and the degree of hands-on experience. And this is why Ogunsalu is not interested in more than 6 delegates. I'm not interested in teaching more than 6, because by the time you teach 10, they're not going to get everything unless you extend and that is why I'm talking to you about Mombasa. Monitoring is an important attribute that university-based course can offer. Now, let us look at treatment team responsibility. Communication is very important, team approach, and cooperation. It is tempting when considering the practical difficulties of maintaining good line of communication between separate clinicians for one clinician to carry out all aspects of treatment. And one of the things about dentistry is that, you see, the mirror, you see that mirror that we use, It is a standard mirror, It's a standard mirror. And we look at it, we use it, but we see things differently from each other. And that is a problem in dentistry today. So, and manufacturers' involvement is very key to osseointegration and biotechnology. And when manufacturers observe that a product is not serving its purpose, maybe it is time for them to withdraw. Now, what should precede dazzling marketing? If you are marketing something very, very aggressive, then you must try and make sure it is of high standard. You must support research for the validation of the product. So that when I come to you and I say, hey, I want to do research for your product to show that this and that and that, you must go and bring money for me to do it. So we've done very well. We're going to take a little break. So we're talking about pathologic exfoliation of implants. When an implant begins to migrate out of the socket which you have placed it, it means the implant is undergoing pathologic exfoliation. And basically, we're going to be talking about pathologic exfoliation of an implant in position number 1-1. This is another view of the exfoliating implant. And you see, the story of this implant is as follows. I did the implant. It was my last case for 2004. I had placed multiple implants for him in the maxilla on the left side, and very lovely surgery. Flew back to Trinidad, and my staff called me just after Christmas that Mr. Lewis says that his implant is coming out. So I said, one of the implants is coming out. So I said to them, tell him he's just imagining things. There is nothing like that. And then in January, he called them again and insisted that there is something wrong, that the implants are coming out. Anyway, when I came in January, I saw him, and I saw that really the implants were coming out. I had actually super synced that implant by 2 millimeters. And this is what was showing in his mouth. I tested for mobility. There was some degree of mobility. So I decided to use the artery forceps to hold the polished surface of the implant and then remove the cover screw. I inspected, and I decided to explore. Next. So that's it. Next. Right. Now, previous. Right. So when I open up, everything looked nice to me. Everything really looked nice. And I was tempted to just tap this implant back into the socket and probably put some bone graft there. But then I looked again and looked again, and I saw a retained root adjacent to the implant. The retained root was adjacent and was in such a presentation that it was upside down. So this is going to take us to history now. Next. I looked again, didn't see anything. Next. 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 Right, so I removed the retained root. Next. And then I put back the cover screw. Next. And of course, I did some bone harvesting from the mandible. In those days, there was no bone scraper, and I think I removed too much bone. And next, look at the apex of the retained root. That is why I did not see it on X-ray. And it really made me look like a fool. So I cleaned out, I grafted this, I put bone graft there, I covered up, and the patient is good. The patient had 4 implants along this long span. And that takes us to history. So I said to him, this is strange. I said, even if it is there, so the retained root is there, it shouldn't be this presentation. So I said, So I looked at his mouth and I realized that all the teeth in his mouth were nice and lovely. No cavity. So I said to him, how did you lose your teeth? He said he had a motor vehicle accident and that, all the teeth were shattered and broken into the gum and they had to be picking them. And that was it. So history is very important. You must ask the patient, how did they lose the teeth? And next. So I learned a lesson from this. And then this is part of my bone graft. Next.
Did you tap the implant back in?
I tapped it back in, yeah. And as you can see, you can't see it there. Next. And the patient is okay. The patient eventually migrated to Canada. And I referred him to get the restoration done at the University of Toronto. It's a restoration I would have loved to do myself, but, This is going to be a very quick one. Like I told you, one of the complications of dental implant is fracture of the pilot drill. And the pilot drill is the most easy to be fractured. The round ball will not fracture because of the kind of work you make it do. The pilot drill can fracture if you do not use it properly or if you overuse it and you don't change them, right? Next. Now, this is a well-known but unreported complication of implant surgery. It may be due to overheating of stainless steel bore tip. And there is a dearth in the literature regarding the management of these cases. Now, it should not initiate a medico-legal process. However, lack of knowledge regarding management of this unpredictable yet preventable complication may excite a medico-legal process if you do not know what to do. The immediate sequelae of the retrieval attempt, if the bore fractures in the osteotomy site, what can happen is that you could have damage to the ID nerve or the mental nerve. You could have lodgement into the soft tissue. You could remove it and the patient ingest it, or it could go through the respiratory tract via the oropharynx. Or it could go into your suction tip. If it's in the maxilla, you could introduce it into the maxillary sinus. So you have to be careful. Now, fracture of the surgical drill in the osteotomy site is an intraoperative complication of the surgical phase of dental implant therapy. And, maybe you will want to abandon the implant procedure altogether. Or maybe you want to change the osteotomy site. But is it possible for you to change the osteotomy site? Is there enough space for you to do that? Is there enough bone for you to do that? Or, do you want to proceed and damage the ID nerve? Next. Now, a change in the osteotomy site may not be feasible because of restorative considerations or unavailability of bone in the next possible site. Now, you may try to use the simple time-saving technique described by Fife. This was in 1966 in the Journal of Oral and Maxillofacial Surgery as British Journal. Now, he reported that a lot of bones are fractured during third molar surgery. And really what is done is nobody reports how it is removed or what was done to it. And he eventually designed a technique how to remove this fractured bone. Now, let us look at leaving the fractured bone in situ. When you leave it in situ, you must look for immediate or delayed onset of altered sensation. You must look for evidence of infection or even foreign body reaction. Now, this was a case of multiple implant that I did. And as you can see, fractured component there of the pilot drill. And when we took the X-ray, when the fracture occurred, when we took the X-ray, and this is a lesson I want you to learn from this, we saw the fractured piece, and we made every effort to remove it. And immediately we removed it, we were like, oh, thank God. Thank God. And we went ahead and we placed the implant. And it was after we finished all the other implant procedure that we took the X-ray and we saw that there's another piece there. Yet I had removed a big piece. And, I felt so disappointed in myself, that I tried to remove this thing and then I still left a little piece. And I blamed myself that, I should have taken another X-ray, but because you removed this big chunk, you thought it was the one. And when I examined the pilot drill, and you must examine the pilot drill tomorrow, anytime the pilot drill fracture, it fractured into two parts. And look at the design, and you will see. Now, it shouldn't fracture. It's a new one, and what I found out later was that I used the extension drill, and I did not tighten the bore well to the extension drill, so it wobbled and it fractured. Next. And again, I had another patient, and this patient had like a D1 bone in the posterior mandible. Next. And this is what happened. And the fracture was very close to the inferior dental canal. I just left it there. Okay? Now look at the pilot drill. See right here? This is a big chunk that will fracture. This is a little piece that will also fracture. Okay? Next. So causes of fracture of pilot drill. Another lesson to learn. Lack of lock or engagement into the handpiece. Lack of lock or engagement into the extension drill. Excessive pressure in D1, D2 bone. Next. And that's it.